Navigating the prescription drug landscape is difficult, even for an individual with a graduate degree in the field. It should not take a PhD and an infinite amount of time and patience to figure out how much a prescribed medication will even cost the consumer.
Good morning. Welcome to Washington Post Live. I am Leanne Caldwell, anchor, Washington Post Live, and also co-author of the Early 202 newsletter. Today, I am delighted to be joined by Republican Senator from Maine, Susan Collins, and also Democratic Senator from New Hampshire, Jeanne Shaheen. Thank you so much for joining us today. We are talking about a very important topic, which is the price of healthcare. Specifically with both of you, we're going to talk about the price of insulin, which is something that you both have been working on for a very long time. Just want to take a step back here and set the stage. We have according to the nonprofit RAND, the price of insulin in the US is $98.70 compared to overseas, where it is $7.52 in the UK. So I'm going to go right to an audience question who gets at this. Bob Carey from DC asks, how much of this cost issue is related to manufacturer pricing and how much is related to pharmacy benefit managers, also known as PBMs, and especially when PBMs allow brand name versus generic and copay amounts? So there's a lot in that question. So let's start with Senator Shaheen. Why do you think that the cost is so much more here in the United States?
Well, it is the PBMs that have driven up the cost. That's very apparent. And we are making some progress on this. We have finally said for people on Medicare, we're going to cap the out-of-pocket cost for insulin at $35. And Senator Collins and I have legislation that would do that for everyone, but more importantly, would get at the underlying list price for insulin, which really hasn't changed as a drug very much in over 100 years since it was first discovered, and yet the price has gone up exponentially. So clearly, somebody's making money on this, and all of our analysis shows it's the PBMs.
Senator Collins, do you agree?
I do. The problem is that the system is rife with conflicts of interest and perverse incentives. When PBMs choose which insulin for an insurer's formulary, they are compensated usually by being paid a percentage of the list price. So that encourages the manufacturers to have high list price because they want their brand of insulin to be chosen for the insurer to use for its beneficiaries. When you have that kind of disincentive built into the system, it leads to higher costs. There was a provision also that was included by PBMs in the contracts that they had with insurers and pharmacies that were called gag clauses. And it actually prevented a pharmacist from telling a patient, a customer, whether or not it would be cheaper to not use insurance and pay out of pocket. Fortunately, we were able to get that practice banned. But I tell you about that because it's yet another example of the role that PBMs play in keeping the cost high.
So you guys have bipartisan legislation. We have a Republican and a Democrat sitting here. Senator Shaheen, what specifically would your bill do to lower the cost? You mentioned a cap. What else?
Well, again, Senator Collins and I co-chair the Diabetes Caucus. Senator Collins was doing that when I got to the Senate, and I've been so pleased to be able to join her. And we've been working on this legislation now since 2019. We introduced the first iteration of our bill in 2019. We've worked on it since then. It caps those out-of-pocket costs, which, by the way, 25 states have already done. So we know that this is something that people think is a good idea. It also would get rid of some of the requirements that force people to get agreement before they can get certain health care for their diabetes, which is really important. The name is escaping me of
Prior authorization.
Thank you, prior authorization. See, that's the problem with our healthcare system. There's
So the terms.
yeah. But the other thing it does is it expedites the ability to get generics onto the market. Right now, we don't have a generic insulin, which is one of the real challenges. So getting those biosimilars into the market would really help with the list price. And then it addresses the PBMs when it comes to insulin.
So, Senator Collins, is there a way to ban PBMs? Are you able to do that in your legislation?
I don't think we should ban them, but I think their compensation should not be linked to the cost of the drug that they're recommending. Instead, it should be a flat fee situation. The other thing to know is this market is incredibly concentrated, as Senator Shaheen has mentioned. We have only 3 major manufacturers of insulin, and the major PBMs are all owned by insurance companies. So to get that benefit to the patient has been really difficult. There's so many perverse incentives that drive up the costs. And Senator Shaheen was mentioning also the need for us to have more biosimilars. Well, finally, in the last year or so, there was a biosimilar, that's the equivalent of a generic for insulin, that was introduced onto the market. Well, guess what? It was way cheaper. It could not get chosen by the PBMs for a single formulary, but for an insurance company. And so what did they do? The company relaunched its biosimilar at a higher price, and then it got chosen.
But I think the good news is that we're seeing legislation to address some of those PBM excesses come out of both the Finance Committee and the Health Committee in the Senate, and also we've seen legislation go through the House Committee as well. So there is bipartisan support to address this issue.
Why hasn't this passed previously? Why hasn't this idea, anyway, you guys introduced this legislation this year, but why has it been so difficult to control the price of drug? What is the challenge that is out there, either internally within the Senate or externally within the industry?
Well, I think the pharmaceutical industry has has a very large lobby on Capitol Hill, and they have been very effective. But I think now people are beginning to understand what the impact of those high drug prices are, and being louder in terms of contacting their senators, their representatives to say, this is a real problem. There's also a huge cost to the federal government for not addressing PBM reform and not addressing the high cost of prescription drugs. And so we could lower the cost of healthcare. Right now, diabetes is one of the most expensive chronic illnesses we have in this country. We have 37 million people who have diabetes. And if we could address the high cost of insulin, that would be a huge saver for the federal government.
Last year in the Inflation Reduction Act, as you already mentioned, there was a cap on insulin at $35. That was for people on Medicare. Senator Collins, you did not vote for that for
I did vote for the cap.
Right, but because I was going to say, because of all the other things that were in the legislation. So I do want to ask you, though, was that a good start in bringing down the cost of insulin, even though it only is for people on Medicare at this point?
It is a good start, but what we should keep in mind is that the people who tend to need insulin as a matter of life and death are a lot of young people in our country who have type 1 diabetes, not type 2 diabetes. And for them, insulin is a matter of life and death. And so there's a lot more work to be done, and that's why I'm so happy with our partnership on this issue. You asked earlier about the pushback on it. I think that is changing. Senator Shaheen and I have worked very hard to get more co-sponsors, but what has made the difference is members of Congress are hearing from their constituents. And I remember a recent case where a woman from Maine, a young woman from Maine, came and told me that she had been rationing her insulin because she could not afford it. She had gotten off her insurance plan of her parents, and she was trying to stretch it out. She has type 1 diabetes. Well, guess what? She ended up in the emergency room, almost died. And believe me, not only would that have been horrific and tragic, but it's also a lot more expensive to take care of her in an emergency room than to help her with the cost of insulin.
That's right. So we would pay for that emergency room visit, but we wouldn't pay for the prevention that helps keep people out of the hospital. You know, I also have a personal connection to this issue because my oldest granddaughter has type 1. And she comes from a family that has health insurance, resources, knows how to navigate the system, and I've watched the challenges that they have. So I can only imagine how difficult it is for young women like Senator Collins is talking about, and others who don't have that health insurance, don't have that help to navigate the system. And that's what we've got to address. That's what our bill is about. It's trying to ensure that everybody can get that access to insulin, which is, as Senator Collins pointed out, life-saving. This is not a case, you know, I was meeting with a group of advocates who have type 1, and one of the things that they said to me, this has been years ago, right after I got elected to the Senate, but they said, you know, I think the problem is we don't look sick, so people don't understand that access to insulin is life and death for us. And I think there's a lot of truth in that. So this is an issue we've got to address from a policy perspective, but also from a personal perspective to make sure that people have access to what they need to live productive lives.
You mentioned your granddaughter, Senator Collins. You started the Diabetes Caucus in 1997. I want to ask you about that in a second, but just to follow up, Senator Shaheen, is that why you joined the Diabetes Caucus, because of your granddaughter? Can you talk about why this has become so important to you?
Well, it is. You know, as governor, I also worked on this issue before I had my granddaughter and before she got diagnosed, because it's a huge policy issue as well. It is one of the most expensive chronic diseases. We pay a lot of money, and we still have people who don't get what they need. And the example that Senator Collins said is a really good one. We'll pay to put somebody in the hospital, but we're not going to pay to give them the training, the preventive information that they need to stay out of the hospital. And that's just a crazy policy that needs to change. And then, of course, when my granddaughter got diagnosed, there was also a very personal reason to do everything I could to try and address this issue.
And Senator Collins, for you, why did you create this caucus that is devoted to this issue of diabetes?
One of my first constituent meetings when I was elected to the Senate was in early 1997 in my Portland, Maine office. And it was with families who had children with type 1 diabetes. And I'll never forget this little 10-year-old boy looking up at me and saying, Senator Collins, I wish I could just take one day off from having diabetes, my birthday or Christmas. And of course, he never can. And I came back to Washington and I said to my staff, I want to join the Diabetes Caucus. And they said, there isn't one in the Senate. And I said, well, there is now. And I'll tell you, I've had great people to work with over the years, but none has been more committed than Jean Shaheen. And we've worked in a completely bipartisan way. Diabetes doesn't care if you're a Democrat or Republican or what. And it's been very rewarding to work on the Special Diabetes Program, which provides research dollars and has led to tremendous breakthroughs in the technologies, including continuous glucose monitors, which helps test the blood sugar and avoid the needless blood tests day after day. And so we've seen the difference that technology can make. And Jean can tell you about a very exciting development that's happening.
I just went to a groundbreaking in August between a company called Lonza that manufactures pharmaceuticals in New Hampshire and a company called Vertex, which has been in Cambridge. And they are going to produce islet cell therapy, which is, I believe, going to be a cure for diabetes. They already have one person who has been insulin-free for 3 years. They are in clinical trials. Hopefully the FDA will continue to allow them to move forward with those clinical trials. But it's very exciting what's happening there. And so we're hoping to, when they finally have the new center up with Lonza, we want a tour so we can really see firsthand the difference that that's going to make for people.
If they're already in clinical trials, then that timeline must be relatively quick, or no? How far off are we?
Well, there have been some challenges with getting the clinical trials. I think they're moving forward
Bureaucratic
now.
challenges, or?
Yes.
Oh, okay.
Bureaucratic
FDA.
challenges from the FDA.
Okay. So you guys do not have the only legislation addressing insulin on the Hill. There's one also by Senator Warnock and Senator Cassidy, which is also bipartisan.
Actually, it's Senator Kennedy.
Kennedy, thank you. So what, is theirs compatible? Is yours better? And what's the progress of moving this forward this year?
Well,
Not a lot of time left.
we've been meeting with them for some time. Our staffs have been meeting, and we're hoping that we can come to an accommodation where we can get one bill that we can all support.
There are other bills as well that are really important. For example, we need patent reform. We need that generally for prescription drugs. Right now, when a patent expires on a prescription drug, you will often see a company go file a whole bunch of new patents to try to prevent a generic equivalent from coming to the market. We've seen practices where pharmaceutical companies will actually pay the generic manufacturer to delay bringing that new drug to the market. Those are broader than insulin, but they are important as well.
And they also drive up the cost of prescription drugs.
Just want to take a step back in the healthcare system, generally speaking. Life expectancy, my colleagues at the Post had a big series about life expectancy and how it is declining in the United States. We are one of the richest country in the world, and with declining life expectancies. I know the problem is very complex, and you guys are trying to address a part of it. But are there any thoughts that you have about this issue and what else Congress should do?
Yeah, one of the biggest reasons for the declining life expectancy over the last few years has been the number of people who have overdosed, the opioid epidemic, and the now fentanyl as part of that has been a huge problem in my state of New Hampshire and throughout the country. And there is much more that we need to do. We need to address China's allowing in precursor drugs into the United States that are then precursor chemicals that are used to make fentanyl. We need to address our southern border issues and northern border, for that matter, in terms of fentanyl coming across to the United States. And we need to educate people about the potential catastrophic impact of using fentanyl and pills, the look-alike pills that now are out there, available on the internet, available in so many places that have fentanyl in them and cause people to overdose, is something that we need to make sure people understand.
Mm-hmm. I agree with every word that Jean just said. Let me list 3 factors. One is definitely the drug crisis, and I think we often focus, understandably, on the number of deaths through overdoses. In Maine, it was 763 last year. That's so sad. But here's the more startling statistic. There were 10,000 overdoses in the state of Maine. 10,000. So those are people who were saved, but that's a huge problem that is affecting the health in this country and lowering our life expectancy. Second, I think we need to put more emphasis on prevention, on wellness, on lifestyle factors. And there's more and more research that identifies lifestyle factors as major contributors to diseases. And third, we have a real problem with a shortage of healthcare professionals, particularly in rural states like ours, and particularly behavioral health professionals. So if you're living during COVID, I got a call from a selectman living on an island in Maine. And he said, what are we going to do? We don't have broadband, so we can't do telemedicine. If we take the ferry and drive the hour to the doctor's office, it's closed. So how are we going to get health care? Mm-hmm. And one of the other projects that Senator Shaheen and I've worked on in the infrastructure bill was to bring broadband to all Americans, $65 billion that we negotiated. That's going to help improve our life expectancy, because it means no matter where you live, you'll be able to do telemedicine at least, and that's going to be very helpful.
I want to now switch to a couple news of the day questions. Of course, there's this horrible war happening in Israel, Gaza. Senator Collins, you are ranking member on the Appropriations Committee, top Republican on the Appropriations Committee, who will help to usher through a supplemental. The Washington Post and others are reporting that it could be up to $100 billion for Ukraine, for Israel, some Taiwan, maybe some southern border money as well. Is that an adequate amount? Is that too much? And at what, can you talk about the framework of the supplemental at this stage?
Well, first of all, I expect that the supplemental is going to be submitted to Congress tomorrow. Okay. And I expect to get briefed on it this afternoon. Senator Shaheen is also a key member of the Appropriations Committee. Our hope, the chair, Patty Murray, and I hope to hold a hearing on the supplemental, perhaps as early as next week. I think that would be very helpful. I do think it will have the 4 elements that you've described in it, and I think each of those 4 are critical. And I hope through a hearing that we can answer questions, find out exactly where the money is going, whether it is the right amount. I have not heard a top line yet, so I don't know what that will be. But assisting Israel as it confronts the worst terrorist attacks and the greatest number of deaths since the Holocaust is absolutely critical. And a group of us in the coming days are going to be visiting Israel and to show our solidarity with the Israeli people. Ukraine is not only the right thing to do, but it's in our self-interest. The Ukrainians are taking on an adversary of the United States. Russia's brutal, unprovoked war must be countered, and they're doing it with the help of our ammunition and supplies, but no American soldiers are on the ground to help. And then the southern border is out of control. We've got to worry not just about the Ukrainian border, but about our southern border, which, as Jean said, is a thoroughfare for drugs as well, being smuggled into this country. And finally, sending a strong signal to China that it should not attempt to seize Taiwan is very important as well.
Senator Shaheen, there was a classified briefing yesterday for all senators about what's happening in Israel. We have all heard how the president has addressed Israel. He just returned. He's going to address the nation tonight. Do you think that his stance and his tone regarding the conflict has been appropriate? And what do you want him to say tonight?
I do. I think he's not only shown the support of the United States for Israel, but also, and this sadly hasn't gotten reported as much or heard as much, I think, he's expressed the concern about what's happening with the Palestinian people and the humanitarian crisis there. And also the need to address, to try and prevent the expansion of hostilities beyond Israel and Gaza and the West Bank. So that there is very real concern at this point that this conflict could spread across the Middle East in ways that we have not seen in a very long time. There's also real concern about the potential for unrest in cities across the world. If you looked at the demonstrations that have happened in the last 24 hours, we've seen tens of thousands of people come out and demonstrate, and there's concern about terror attacks happening. We've seen that in the United States already, both anti-Semitic and anti-Muslim. So I think it's very important for the president to help calm the situation, to talk about the role that the United States can help play in addressing the violence that we're seeing.
We only have don't have 10 seconds left, but I'm going to ask you in 10 seconds, do you think that there should be a ceasefire at this point, Senator Shaheen?
I think that's going to have to come from negotiations. If obviously the Israelis need to feel like they have addressed the threat from Hamas. The Palestinians need to feel like there's some humanitarian assistance to help end the real suffering there. But it's not going to be for the United States to say whether they can broker a ceasefire or not. The parties have to come to the table to help.
Senator Collins, same question very quickly.
I generally agree, but I think Israel has to crush Hamas.
Great. Thank you both so much for this wonderful conversation today. I really appreciate it. Senator Shaheen and Senator Collins, thank you. And we will be right back with more.
Thank you.